In the process of continuing to discuss the axial skeleton, we have already addressed the vertebral column, and in this presentation we're going to explain the thoracic cage. Now, why is the thoracic cage part of the axial skeleton? It is because it starts at the thoracic vertebrae. The ribs are going to extend from the thoracic vertebrae, curve around, and attach to a central bone called the sternum. So it starts at an axial skeleton point and ends at an axial skeleton bone. Therefore, it deserves the term axial part of the skeleton. The front part of the thoracic cage is made of a central bone called the sternum. The sternum is also called the breastbone. It is a flat bone, and it has a superior end and an inferior end. This is the superior end, and it is called the manubrium sterni. What is its shape? It is quadrangular in shape because it has 4 sides. Now, what are the main features of this manubrium? First of all, it has in this area a notch. This notch is going to receive the medial end of the clavicle, and this is the point of attachment of the pectoral girdle with the axial skeleton, and it makes the sternoclavicular joint. And there is a depression in the middle called the jugular notch. And then when we come to the sides, we can see that the first rib is articulating with the manubrium sterni. And then when we go lower down, we can see that there is a line, a transverse line called sternal angle. Underneath or inferior to the manubrium sterni, we can see this blue marked area of the sternum, and this is the body of the sternum. It extends from the upper border, the sternal angle, lower down to the triangular structure, which is called the xiphoid process. It articulates with half of the second rib, then third, the fourth, the fifth, the sixth, and the seventh. And it has transverse line because of the fusion of the different parts of the body of the sternum. Can I feel my sternum? The answer is yes, because it is subcutaneous. When we look at the tip of the arrow, we can see that there is a transverse line, and in real life it is a transverse depression, and you can feel that on your sternum, and this is called the sternal angle. Is this important? Yes, it is. Why is it important? Because the second rib comes and attaches halfway, one half to the manubrium sterni and one half to the body of the sternum, and this line indicates the position of second rib. Lower down the inferior end of the body of the sternum, there is a cartilage marked green inside the circle. This cartilage is called the xiphoid cartilage, and when you look at the cartilage of the seventh rib, it comes and articulates halfway to the body of the sternum and halfway to the xiphoid process. What is this image showing? To your left, it's showing an anterior view of the sternum, and to your right, it is a side view of the manubrium and the sternum and the xiphoid process. In the last 2 or 3 slides, we were discussing very important points, and we want to make it clearer in this slide. Now, the manubrium sterni, first of all, it has a depression for articulation of the clavicle and makes sternoclavicular joint. Then, to the side of the manubrium sterni, the first rib is going to articulate here with the body of the manubrium, and there is a notch for it. Then the second rib is going to articulate with the sternum, one half with the manubrium and one half with the body of the sternum. Then we have on our right articular facet for the second rib, where we can see that half of it is on the manubrium and half of it is on the sternum. Then we have a notch for the third rib, fourth, fifth, sixth, and seventh costal cartilage articulation. All these are articulating with the sternum, and these ribs articulating with the manubrium and the sternum are called true ribs. Now, the last costal cartilage to articulate with the sternum is the seventh. Then the eighth, the ninth, and the 10th, they articulate not with the sternum, but with the costal cartilage of the 7th. Now, what are the green structures? The green structures are the costal cartilages. If we follow a rib from posterior, as it goes lateral, and when it starts to come anterior, stops as a bone, and the cartilage articulates with the anterior end of the rib and continues to the body of the sternum. These are called costal cartilages. They are there to allow the little movement of expansion of the chest. Let us see what we can learn from this cartilage. Now, the blue structures are the bone part of the ribs. Now, the first rib is going to continue as a cartilage, and it articulates with the manubrium sterni. Second rib is going to articulate halfway to the manubrium and halfway to the body of the sternum. Now, this is the third and fourth and fifth and sixth and seventh. These 7 ribs articulate with the sternum, and they are called true ribs. Why? Because they start at thoracic vertebrae and end up anteriorly on the sternum. They are 7 in number. Let us continue the story of the ribs. This is the 8th rib, whose cartilage does not reach the sternum, but it comes and attaches to the costal cartilage of the 7th. So that's the 8th, and that's the 9th, and that is the 10th. These are false ribs. The last group of ribs, which is composed of only 2 ribs, it is the 11th and the 12th, and they are marked green in this image. They start at thoracic vertebrae and they turn posteriorly, and as they come anteriorly, they stop. The answer is they are not attached to any structure, therefore they are termed as the floating rib. The question is, do they have a costal cartilage? The answer is yes, they do, but it is not developed and it looks like a cap at the tip of the rib. What information can I extract out of this image? It is the fact that ribs don't run horizontal. They run obliquely down. They reach a point of the costochondral junction, and the cartilages, they go up to the attachment of the sternum or to the next costal cartilage. The question now is, what are the basic parts of a typical rib? Number 1 is the head of the rib, which articulates with thoracic vertebra, and there is a facet for articulation, and the facet is a smooth area for articulation, and the head of the rib usually, not always, usually articulates with 2 vertebrae, half of it for the above vertebra and half of it into the lower vertebra. So this is the head. Then we have the neck, a constriction beyond the head. Then we have an elevation, and this elevation is called the articular tubercle, and the articular tubercle has a facet for articulation with the transverse process of the vertebra. So this is the rib tubercle. Then we can see there is a turn of the rib, and this turn makes an angle, and therefore this is the angle of the rib. This is the usual site of fracture of the rib when it is exposed to trauma. And then we have this groove on the inferior part of the rib. This groove is for blood vessels, arteries, veins, and nerves as well to travel under the rib, and these are called the intercostal neurovascular bundle. And this is the shaft or body of the rib. Here we have the different kinds of ribs. That means when we ask ourselves, Are all ribs the same structure or the same length or size? The answer is no. At the top of the image, you can see that there is a short rib, and then they get, as you go down, they get larger and longer, and then at the bottom, the 11th and 12th, they are smaller. So they start as small ribs, they come down as longer, and then they change shape into smaller ones. Which rib is this? This is a short rib, and it has different features. And this is rib number 1. It has a head, all right, that articulates with the manubrium sterni, and then a neck and articular tubercle to articulate with the transverse process. And then as we come to the shaft or the body, it has a superior surface and an inferior surface, a medial border and a lateral border, and there is a little elevation for attachment of a muscle called scalene medius. Now, anterior to the scalenus medius, there's a groove where subclavian vein pass, and a groove posterior to the tubercle where the subclavian artery pass. And we will see these structures in the next slide. What do we see here? We see the situation of the clavicle as it articulates with the manubrium, and then underneath it is the first rib. The first rib is usually hidden under and inner to the clavicle, and here is the scalenus medius muscle, and this is the subclavian vein, the vein under the clavicle. When it crosses the first rib, it makes a groove on the superior surface of the first rib, and then posterior to the scalene tubercle, we have the subclavian artery crossing the first rib and makes an impression on superior surface of the first rib. I will leave commenting on this basic units of the rib for you to practice your knowledge. This is an image of a typical rib which is colored, and it may be useful to certain number of students to study it and have more knowledge about the parts of a typical rib. This is a typical thoracic vertebra, and this is something you have seen already when we addressed the vertebral column, and you can see that the superior articulating process facet faces posteriorly, and this one as well, and then we have inferior articulating facets, and we have in this image the blue marked area are facets for articulating with the ribs. Now, we have said previously that a rib articulates with two vertebrae, so each vertebra has half a facet or semi-facet or demi-facet for articulation of part of the head of a rib. So this is superior costal facet, and this is also superior costal facet in a lateral view. Now, in this image, although it is a drawing, we can see that the head of the rib articulates with the facets of the vertebra, and then as they go posteriorly, they articulate again with their articulating tubercle and the transverse process of the thoracic. In this image, I can see a typical thoracic vertebra. Why is it thoracic? Because its spine points downward, plus the presence of these facets on the body of the vertebra. Not all vertebrae have the same arrangement, but there are usually two articulating facets on the body of thoracic vertebra. Now, in this image, I can see that there is part of the thoracic vertebrae and two ribs, one on the right, one on the left, articulating with the vertebral column. Inside this circle, I can see that the head has two facets, one articulating with the superior vertebra and the inferior one articulating with the inferior vertebra. This is the half of the head articulating with the superior vertebra, and here is the other half articulating with the inferior. Look, here is an advice for you to get good marks in the exam. The idea is test yourself and test your knowledge before somebody else tests it for you. Now, when you test yourself, you discover what you know and what you don't know, and you correct and update your knowledge. Look into these questions. Explain the differences between true and false ribs. This is something you should know by now. Explain differences between false and floating ribs. How the vertebro-sternal ribs articulate to the vertebral column and the sternum. You have just heard this information a few seconds ago. Explain what the sternal angle is and describe the locations and purposes of the clavicular and jugular notches. These are just few examples, and try to answer them.